3 new studies published in the Lancet contribute to the mounting evidence that for middle-aged individuals, taking a low dose of aspirin every day can help prevent cancer, especially if they face an increased risk for the disease. The researchers also indicate this benefit appears after 2 to 3 years, rather than 10 years as previously thought. They also found aspirin capable of treating cancer in people who already have the disease, contributing to evidence that it reduces the risk of metastasis or spreads to other parts of the body. The studies were conducted by Professor Peter Rothwell of Oxford University. For the first study, Rothwell and colleagues collected data from 51 randomized clinical trials that looked to compare the effect of daily aspirin use with not taking any aspirin on cardiovascular events like heart attack and stroke. These trials also collected data on cancer. From the results, it was established that aspirin lowered the risk of cancer mortality by 15%, and this reduction increased with long-term use. For example, those who took it for 5 years or more saw a 37% reduction in cancer risk. In their second study, Rothwell and colleagues examined the impact of aspirin use on metastasis, an event where cancer spreads beyond its original site. In this study, the researchers pooled data from 5 large randomized UK trials that monitored aspirin use in preventing heart disease. The results indicated that aspirin use led to a reduction in the risk of metastases occurring. The risk was lowered by 36% over the 6.5-year average duration of the studies and did not vary by age or gender. For their third study, Rothwell and colleagues again investigated aspirin and cancer risk. However, this time they systematically reviewed observational studies instead of clinical trials where participants were randomly assigned to different treatment groups. This analysis confirmed their previous findings and found similar reductions in cancer risk.